white, you peel off this white paper. When you peel it off, make sure that this white paper, when you peel them off, it is properly kept, because you are going to use it to cover back the electrode pad to protect it. Now, you paste this wherever you want to treat, just like that, and that's how you do it. You place it the places you want to treat. We said you can see they are all connected to the pins, to the 4 pins. And now, firstly, we want to show you how to treat headache. The problem of headache. But firstly, I want to introduce you to the acupoints that are necessary for the placement of pad. First of all, you see the forehead here is one of the acupoints. Then at the lower part of the neck, this neck here, at the back, please bend. Neck here is another acupoint. Here is another acupoint. And here is another acupoint, because there are veins within those places that are connecting to the head tissue. Now we're going to place the parts in those places, on those places. Now watch how it is being placed. This is how it is being placed. You can see that I'm keeping these covers properly. Now, this is how it is being placed. Now you can see this is the right way to place the pad for the treatment of headache. You can see the one at the back, how it is placed. So this treatment, you apply acupuncture for 1 to 3 days. 1 to 3 days. Why 1 to 3 days? Sometimes you could just apply it and the headache is gone. But where it persists, especially migraine or serious headache, you treat for like 1 to 3 days each time, and for 5 minutes. 5 minutes, and you use not more than 2 intensities, as explained on the machine, usage of the machine. The intensity shouldn't be more than 2. Show you how to treat arthritis. Then, if for instance some people suffer arthritis on both legs, it is advisable that you treat each leg separately. You don't place 2 here and place 2 here. It is safer and better to first of all treat one. This is how you place the pad. You place one here, you place another here, then you place another one here, then another one here. That's how to place the pad for the treatment of arthritis. For arthritis, you use the treatments acupuncture and manipulation. Again, acupuncture and manipulation. You use them 15 minutes each for 30. That's 30 minutes in all. 15 minutes each. 15 minutes of acupuncture, 15 minutes of manipulation, making 30 minutes in all. And this is done for 30 days. It is done for 30 days. Note that if you have a mild arthritis, before you get to even 15 or 20 days, it may have cleared. But for these chronic ones, you just have to continue for 30 days. And that is the treatment cycle for such. Whereby you treat for 30 days and you're still feeling some little symptoms, you allow it for another 5 days. You keep it free from another 5 days before you start another phase of treatment. And that phase of treatment you might take you just like 10 days or 15 days. Demonstrate how to treat stroke function. How to treat stroke. Now, in treatment of stroke, you know that partial stroke, you know that sometimes it is a certain part of somebody, one part of an individual is not functioning well. That part that is not functioning well, that's where you are going to treat. First of all, we'll talk about the acupoints. Here, you notice this ankle, this arm here on the shoulder joint here. This side here at the back is an acupoint. Here too is an acupoint. Then this place is another acupoint, and also here is another acupoint. So these are the places we are going to place the parts. Now this is one of the acupoints. This another acupoint. Then this side, is another acupoint. Then here at the back here is another acupoint at the back of the arms there. What we use here is stroke function. You move to stroke function. You move to stroke function. You move to stroke function. Then when you move to stroke function, you select, it is treated for 10 minutes for each point. This is a point. This point, you treat it for 10 minutes. You treat it for 10 minutes for 50 days. 10 minutes for 50 days. But if you so desire to treat it because of the intensity of the stroke, you want to treat it for 20 minutes, it's still okay. You can go ahead and do that. But basically, the treatment for stroke is for 50 days. Then for the leg part of the stroke, we also have some acupoints. This is where to place the parts for stroke. At the arm, the part of the arm, one side of the arm. Like you on the machine, you scroll to stroke function. It's 10 minutes. You take it to 10 minutes. Then this is the intensity, strong. You begin to press 1, 2, 3, 4, 5, 6, 7, 8. Now this is how it works. If you notice, if you look properly, you will see how it's checking the hand. Now this is the treatment for stroke. This is how you can see how the body is reacting to it. You can see it. You can see that. You can see how it's checking her. So if it is too much for you, we'll go to weak and begin to reduce it gradually until it stabilizes on the body. We will now go to the leg side of the stroke function. Treating stroke on the leg, these are the places you place the part, and this part we are also, but because of inconveniences, we can't really place it on the hip. Basically, this side is one of the acupoints. It should be placed on this part of the body at the joint level, within the hip, and also somewhere at the lap here. So when you do that, you repeat the treatment just as we did on the side of the hand. We will go into the next treatment function now. Treatment of blood pressure and low blood pressure. These are the ways you treat it. This is an acupoint, and this place is another acupoint. Because why? Here, because there are arteries here that are directly connected to the heart region. So now, and being the fact that this electro pad treats directly the nerves inside, that's why it has reaction on it. Then these are the various acupoints. Whether high or low blood pressure, this is how to treat it. You place the pads at this acupoint. What it does is that if it is high blood pressure, it regulates it to normal. If it is low, it also regulates it to normal. The treatment function used for this treatment is called acupuncture and immunotherapy. If you